Okay, so just a few items to go through for the evening. The first thing I thought I would start with is something that came out. I saw it yesterday or day before in the APHA daily email news summary. And this was in regards to Center for Medicare and Medicaid Services and DIR fees. And CMS, after some significant lobbying or communication by our pharmacy organizations, has issued a ruling that eliminates retroactive DIR fees to go into effect January 1st of next year or for the contract year 2024. And essentially what it does is it moves those fees to the point of sale negotiated price and increases some cost transparency for patients as well as pharmacies. This does not have any impact on the fees for our current calendar year or the following calendar year as well, but at least this is some movement in the right direction. So these updates always seem to include a little bit about COVID-19 and vaccines because this is a current, an always moving target for all of us. But earlier this week, there was an opinion piece published in Journal of American Medical Association, and this piece was published by 3 directors with the FDA. And it just stated that we need to be aware that COVID vaccines may be part of the new normal, just looking at the waves of the virus transmission and how the virus evolves. And this may just be something that we're going to have to live with. So there will be some committees meeting this summer to evaluate this and determine if this is something that we will be giving each year alongside the seasonal influenza vaccine. So I expect we'll hear a little bit more about that in the coming months. Thank you for popping that into the chat, very helpful. Okay, moving on to a little bit about the virus and the therapeutics. There was a meta-analysis published within the past month looking at the interleukin-6 inhibitors and their role in treating COVID-19. So as you can see, it was a meta-analysis of 11 studies and almost 7,500 patients. And they compared the IL-6 inhibitors versus standard of care. And if you look on the right-hand part of the slide, the IL-6 inhibitors that they compared were tocilizumab, saralimab, and cetuximab. And I may or may not be pronouncing those correctly, but that's my best stab this evening. And the standard of care that they compared to, depending on the trial, but it included things like anticoagulants, antivirals, corticosteroids, antibiotics. Some of the trials also included chloroquine, hydroxychloroquine as well. And overall, of the data accumulated from the studies, it was shown that the IL-6 inhibitors were associated with a decreased risk of death, which is what you see in the graph on the right-hand part of the slide, compared to standard of care. Some secondary endpoints included a decreased odds of intubation and an increased odds of discharge from the hospital. So I think this provides some interesting information about what may become the recommended therapies for someone who's hospitalized with COVID-19. Moving on, so in case you missed it, because this has been out for a little while, but the United States Preventative Services Task Force issued some draft recommendations a few months ago about the use of aspirin for primary prevention. And these recommendations were finalized just recently. The final recommendations were not changed any from the draft recommendations, but essentially we're not recommending aspirin in quite as broad a swath of patients for primary prevention as we did previously. This does not address secondary prevention at all. And as a quick reminder, secondary prevention is for individuals who have previously had some kind of event, but for primary prevention. So for individuals aged 60 and older without cardiovascular disease, don't start aspirin for the purposes of primary prevention in those patients. For individuals between the ages of 40 and 59 with at least a 10% ASCVD risk, it's an individual decision between the patient and the provider. And the concern here is the balancing the risk of bleeding with the prevention of a cardiovascular disease event. And moving on a little bit, and some of you may have seen some information about this recently, But there's been a little bit of controversy about some mental health startup companies providing telehealth care for ADHD. And Cerebral, Ahead, and Done are three of the names of those online mental health startup companies. And there's some concern for the legitimacy of the ADHD therapy prescriptions. Some of the things that I've seen is these companies had metrics for the number of ADHD prescriptions they were expected to generate, or the ratio of ADHD prescriptions per encounter. And some of the chain pharmacies have actually started blocking these prescriptions from the pharmacies, which, of course, these typically are controlled substances, but on the other side, we have to think about is our patients actually not getting the therapies they need. So that's the last slide that I have, and I thought it would be interesting to hear what some of you may have seen in your practice. Have you seen your pharmacy starting to decline these prescriptions? Have you seen these prescriptions at all? Or are you getting questions from patients about COVID-19 vaccines? So just again, time to hear from everyone in the meeting tonight about things that you might have been seeing.